The clinical attachment level is a tool that aids the clinician in determining the progression or regression of periodontal disease. You may also hear the clinical attachment level referred to as clinical attachment loss. They are synonymous with each other. When calculating the CAL, the clinician is determining the distance between the cemento-enamel junction and the base of the pocket or sulcus. This calculation will provide the clinician with more accurate information about the patient's periodontal health status than a probing depth alone. To calculate the clinical attachment level, you will need a mirror for retraction and visibility, the periodontal probe to take millimeter readings, and you may also wish to have your explorers to aid in successfully feeling and locating the CEJ. We will first discuss measuring and calculating the clinical attachment level when the gingival margin is level with the cemento-enamel junction. We'll first record the probing depth. The probing depth measures from the base of the sulcus or pocket to the gingival margin. On this tooth, the probing depth is 212. 212. Now the clinician is feeling with the CEJ with the tip of the probe to measure from the CEJ to the gingival margin. On tooth number 20, the gingival margin is level with the CEJ, so no math is necessary. The clinical attachment level is the same as the probing depth. So in this case, the clinical attachment level is 212. Dentrix will calculate the clinical attachment level automatically for you after entering the probing depth and the height of the gingival margin. The probing depth of 212 is recorded in the row labeled PD. The height of the gingival margin is recorded in the row labeled GM. For this tooth, the gingival margin is level with the cemento-enamel junction, so no number needs to be entered in this row. In the row labeled CAL, the clinical attachment level is now calculated for you. Next, we will measure the clinical attachment level when the gingival margin is apical to the cemento-enamel junction. In this case, the patient will have recession present. Again, we will begin by recording the probing depth. When recording the probing depth, the clinician is measuring from the base of the pocket or sulcus to the gingival margin. Here the probing depth is 111. Again, the clinician is using the tip of the probe to feel for the CEJ and records the recession measuring from the gingival margin to the cemento-enamel junction. The recession reading on this tooth is 2 on the direct facial. To calculate the clinical attachment level for this tooth with recession, we now add the probing depth to the recession reading. After adding the two measurements, the clinical attachment level is 131. If the clinician had only recorded the probing depth, the gingiva in this area would appear to be healthy as recorded readings of 3 millimeters or fewer. The clinical attachment level provides more information about the patient's gingival health status. The clinical attachment level is now greater than the probing depth because of the recession present. Again, Dentrix will calculate the clinical attachment level automatically for you after entering the probing depth and the height of the gingival margin apical to the cemento-enamel junction. The height of the gingival margin is recorded in the row labeled GM. On tooth number 24, the recession is present. The gingival margin is apical to the CEJ. So we enter the 2 millimeter reading for recession in the box labeled GM. After entering this information, the clinical attachment level is shown in the row labeled CAL. Lastly, we will calculate the clinical attachment level when the gingival margin is coronal to the cemento-enamel junction. This occurs when a pseudopocket is present. Just as before, the clinician begins by recording the probing depth. She measures from the base of the sulcus or pocket to the gingival margin. The probing depth on this tooth is 214. The clinician then measures from the cemento-enamel junction to the gingival margin. The use of an Explorer may aid you in feeling the CEJ if you are having difficulty feeling it with a probe. In most cases, you will not be able to feel the CEJ as a perfect band around the tooth. So with the Explorer and a light pressure, you can feel the change from the smooth enamel of the crown to the rougher cementum of the root surface. The clinician can now insert the probe until the tip reaches the CEJ and record the reading at the gingival margin. On this tooth, the measurement from the CEJ to the gingival margin is 2 millimeters of inflamed gingiva, also known as a pseudopocket on the distal. To calculate the clinical attachment level for this tooth with a pseudopocket, we now subtract the distance between the CEJ and the gingival margin from the probing depth. After subtracting, we find the clinical attachment level to be 212. Again, the clinical attachment level is providing us more information than the probing depth. Looking at the probing depth alone, the clinician may assume that this patient has a large pocket with apical migration, but there is no apical migration because the clinical attachment level is less than the probing depth, indicating a pseudopocket is present. In Dentrix, the probing depth is recorded in the row labeled PD. The height of the gingival margin is recorded in the row labeled GM. If the patient has pseudopocketing, where the gingival margin is coronal to the CEJ, the measurement taken from the CEJ to the gingival margin gets recorded into the GM boxes. When recording the reading for pseudopocketing in Dentrix, you must first enter a positive sign before the number as we've done on number 18. This reading then appears in the GM row with a black box around it to differentiate from recession. In the row labeled COW, Dentrix now displays the clinical attachment level automatically for you.